Welcome to Successful Philanthropy. I'm your host, Jean Shafiroff, and this show is designed to highlight the work of leaders here in the United States and then beyond. Today with us, two important women working at Stony Brook, Southampton Hospital. Mirella Cameron Riley, who is the Director of Development, and Laura Borghardt, who is the Administrative Director of the Phillips Family Cancer Center. Let's all welcome Mirella and Laura. And Mirella and Laura, it is so good to have you with us today. And let's start a little bit with the COVID-19 pandemic.
Sure, Jane. Well, thank you very much for having us on. And we welcome the opportunity to really encourage everybody to continue with the vaccination program. We've got very high rates out here in Suffolk. I think that we are one of the areas with the greatest vaccination penetration, but we need to continue because we continue to see COVID cases. The numbers, as we all know, have jumped up a little bit recently, and the only way forward is through vaccination. And we can also tell you that out of all the people that are sickest and need to be hospitalized, the overwhelming majority are those people who are unvaccinated. So we all know that there have been breakthrough cases, but in most instances, those people are in the older generation population. And also we are able to treat them and discharge them fairly quickly, and they don't have to either have prolonged stays or have more intervention or have to go into the intensive care. So the vaccines have been incredibly effective, and so we just really would like to take the opportunity to encourage everybody who has not been vaccinated and who has concerns, and I know Laura is going to talk about some of the concerns that people have that are preventing them from coming in for either medical care or for vaccines, to ask us your questions. We're here, we're open, we want to talk to anyone who has concerns and to allay fears out there, but this really is the way forward to get us out of this terrible pandemic.
Now, you are administering the vaccine right at the hospital. Can you give the hours, and then are you administering all three vaccinations, or give us a little information, please?
Right, so the hospital, right next to the emergency department, we have Parish Hall, which has been turned into, on one side, a testing center where we have our drive-through testing. It's PCR. We process the results on site, so the results come back very quickly, and it's the safest way to get it, to find out whether you're positive or negative, and that's been a great resource for the community. And on the other side is, and it's drive-through, so it's so easy, and it really is the best way forward in terms of testing. On the other side of Parish Hall is our vaccination center, and I believe the hours, and you can always check the website, but it's Tuesday, Wednesday, Thursday, 12 till 6, and we are offering the vaccines. I know we have Pfizer, and I also know that we have Pfizer third shots. The booster shot is available for immunocompromised patients, and there are many reasons why people can be, immunosuppressed. It could be transplant patients, people on certain medications, people who are undergoing maybe chemotherapy or radiation. The list is on our website. It's also available if you look on the CDC website. But there are a list of criteria which, if you fulfill those, then the third shot is available today. If not, then we will have information on our website for as soon as the as soon as we can open up the third shot to the next tier of the population, just as we did in the initial vaccination program. We were mandated by the government to open different levels of the population to the vaccine, and we will probably go through the same process with the booster shot, following the Department of Health, the local government health lines, the CDC health guidelines, to start that vaccination program. We currently have the Pfizer third shot booster available during those hours, and we hope to have Moderna pretty soon as well. And we update our website as soon as we have new information, and that's southampton.stonybrookmedicine.edu. That is the place to get the latest information, or you can call us, because we're here and we want to talk to as many people as possible who need information about getting a vaccine.
I just wanted to ask a question about the mask, because many people who are vaccinated are also wearing masks. How important do you think it is for vaccinated people right now to wear a mask with this new Delta variant? We really don't know what we're dealing with, and I'm just wondering what your thoughts are on mask wearing for vaccinated people.
Well, I mean, we adhere to the guidelines, and we have always continued to wear masks within certain indoor facilities, and obviously healthcare institutions, hospitals and clinics and doctors' offices. We have not stopped wearing masks. I think the guidelines also suggest that for indoor events currently, that masks, indoor activities, masks are recommended because of the transmission rate of Delta. I mean, I know that our chief medical officer has said if you have not had the vaccine, you will get Delta. It is so contagious that you will get it. So did you want to add on the mask wearing, Laura?
No, I think it's incredibly important to maintain safety, especially for patients and individuals that have comorbidities, are immunocompromised, who have illnesses. So I think that, it's always better to be safe than sorry. We still really don't know how this virus is changing, how it's going to mutate, and what it's going to turn into next. We're fighting it with everything that we have. So I feel like, the masks are just, that's that secondary border. It's always better to have something on than to take that risk, because we don't know, and nobody knows.
And moving forward, do you think that there will be more variants arising?
That's a really difficult question to say. I mean, I don't think that anybody even anticipated what happened so far. Right now we haven't seen anything outside of the Delta, but to say one way or the other would be really premature. But is it possible? Yeah.
I mean, we've already seen obviously a few variants.
Yeah.
And the only way to stop it from mutating is to create enough dead ends, enough places where, people are vaccinated. It can't go. If you're vaccinated and it stops with you, then it cannot continue to spread and mutate. So this is why being vaccinated, dead ending the virus is the way to control this pandemic. It's for the long run.
Yes. Now, a lot of people have put their health needs to the side during this pandemic, primarily because they might be afraid to walk into a doctor's office or walk into a hospital, thinking that they're safer just being home. But you advise against that, correct?
Absolutely. In fact, it's somewhat ironic, but I think the hospitals and the doctor's offices have taken such strides in maintaining patient safety that it's probably one of the safer places to be. Here at the hospital, at the cancer center, there's sanitizer everywhere you go. Everyone's wearing their mask. We're wiping things down. Even when it comes down to someone using a pen, we give them clean pens. We have them discard the pen when they're done writing with it. Everyone's wearing their personal protective equipment, which includes the mask, the gloves, the eye shields, the gowning, taking temperatures as soon as you walk in. We're doing tracers for every single patient that walks in. So I feel like, I understand where the concern was originally, where people didn't want to be in an environment where they could potentially get sick. In a hospital and a doctor's office is where sick people go. But I really believe that we've turned the corner with that, and we're really providing a very, very safe outlet for patients. And we are starting to see these patients come in and continue to start getting their screenings and getting checked out. and, taking better care of themselves.
And
yeah,
so,
I would only add to that we had, during even peak COVID, we did not see anyone become infected
Right.
through coming to the hospital or working at the hospital.
Exactly. Good point.
So our measures of infection control have been really tested and proven.
Yeah.
And so we are sticking to all, and we've adhered to and increased all of those sanitation guidelines to make sure everybody is safe.
yes, and as a board member of the Southampton Hospital Association, I have had the opportunity to watch the work of the hospital on a firsthand or a close basis. And statistically, the hospital has really shown in terms of the care of patients during this pandemic. And I think numbers wise, we're well below national average in terms of mortality related to COVID. But I'm going to let Mirella Cameron-Riley discuss that.
Yes, we were very concerned at the beginning about the preparations we needed to take in order to keep our staff and all of our patients safe. And as I said, all of those stringent measures really paid off. And also the creativity of the care team, everybody in here knowing each other, working collaboratively, trying to figure out the best ways to navigate through this. We've now got some really proven treatment options for COVID patients. So there's a lot more knowledge now that we have on how to take care of people if they do unfortunately contract the virus. So that has been very, very helpful. I would also say that going forward, we will continue to stick to the stringent approaches to taking care of patients, even though things have got better in some respects, and we're now, we're having another difficult time with it. We have not relented. We are consistently making sure that we really do adhere to the guidelines. And I think that, people often compare us to city hospitals, and we're as busy as a city hospital in the summer. And we were at maximum capacity during peak COVID, and yet all of our clinical outcomes that you mentioned were much better than some of the city, some of the larger municipal hospitals in terms of clinical outcomes, including mortality rates. So that was a tremendous torture test for the clinical team here. They did come through with shining colors, and so I just hope it's a reassurance to the community that they know that this hospital has outperformed not only community hospitals but the big larger institutions that pride themselves, as we do, on delivering first-class healthcare. The other thing to consider is that we vaccinated about 85,000 people in this community, and we've had some people a few very small, less than 10 people be queasy on site in the post 15 minutes after the vaccination was delivered. And then, we have had people be not feeling well for maybe a day or two. On the other side of that, we have had around 550 COVID patients, and we have had, around 50 mortalities from that. So when people are considering the risks of taking a vaccine that may make them feel a little unwell versus the fact that this disease kills people, I think they really need I think that we really want people to understand what those risks are. In addition to that, other risks obviously include chronic fatigue, long-term COVID risks, and so forth. So there is so much evidence that these vaccines are safe. They're all getting full approval now, as I'm sure you're aware. And there's so much evidence behind. These are not new vaccines. This is a vaccine from a vaccine family which has had decades of approval and clinical trials to demonstrate its safety and efficacy. So we are on a bit of a crusade, and I know I sound slightly evangelical about this, but we really know that to take care of this community, this is the way, where it's really safe to come here. We've had great outcomes. It's a safe place, and we can answer any questions that people have.
Yes, and for our audience, we are with Mirella Cameron Riley, Director of Development of Stony Brook Southampton Hospital, and Laura Borghardt, who is the Administrative Director of the Phillips Cancer Center. And Mirella, I want to switch gears and move away from COVID and talk about your work as Director of Development. I understand the hospital is in the throes of raising quite a bit of money for a center in East Hampton. Talk a little bit about that. Tell us what your goals are, what is left to be raised, and how people can maybe offer and help.
Thank you, Jean. I would love the opportunity. Before I do so, I just want to let Laura also just reassure people who are sick, who have got comorbidities, who are immunosuppressant. She's our person at the cancer center, and I think there's lots of fears and concerns about if you're already immunosuppressed or on taking medication, or how does that, you've seen quite a bit of that, Laura, haven't you, that people have got real fears about the vaccine?
Yeah, they do. Thank you. So people don't want to not get treated, but I think that when you don't have that diagnosis already, it's easy to just kind of put it off. And I think that that's a huge mistake. So we were really very fortunate that during the height of the pandemic, we were still able to treat our patients and treat our patients safely, which they were very appreciative of. And we not only did our own patients, but we had actually hosted Stony Brook for 2 months in our facility. And I can tell you that no one got sick.
Mm-hmm.
We had great outcomes. It was really, really well done, despite how many patients we had, and the patients were so grateful because they felt safe.
Yes.
But I think that the important lesson here is that if you feel like there's something that isn't right, that you shouldn't wait. If you haven't had your screening, it's time to go back. You need to get checked out. You need to move forward with your health, because we don't want to save ourselves from COVID only for you to wind up getting sick from something else because you didn't take care of yourself.
And that's very good advice for sure, not to put off doctor's appointments and different medical procedures that are needed because you're afraid of perhaps coming down with COVID. If you're vaccinated and you're very careful, and you're in a facility such as Stony Brook Southampton Hospital, where the utmost care is taken to protect people from COVID, you're not going to have a problem.
Absolutely not. Don't delay. Come in, make sure you're up to speed with your health and you're taking care of yourself, your family, your friends. Please encourage everyone to stay on top of your own health care. And to the fundraising, so I'd love to talk about East Hampton, but I do want to congratulate you, Jean, because I know you're chairing a very important event this Saturday, the Ellen Hermanson Gala fundraiser, which we are also supporting and the beneficiaries of, as we have the Ellen Hermanson Breast Center here, which Laura is very much involved. We just want to we hope that goes well.
Yes.
And good luck with that wonderful event and the important fundraising work that that event will help, will raise funds for. And Laura, you know about some of the great work that the Ellen Hermanson Foundation offers.
We've been really blessed to work with the Ellen Hermanson Foundation for years. As you know, we have the breast center right here. More recently, we've been trying to work on a very robust plan to kind of cast a greater net to help those in need, those that are underinsured or not insured, to make sure that they get their screenings, to help them with potential procedures or biopsies that they may need. It's been really just amazing to be able to work with that team. We're working to provide social workers, outreach, navigation, both for resources as well as financial navigation to these patients. So it's a new program that it's an old program, but it's a new program, and that we're really trying to get out to more people and expand our footprint. Because I think that the work that Ellen Hermanson Foundation does is just absolutely amazing. And there's just so many people that can benefit from it.
And no question, Julie Ratner, who is the co-founder and chairwoman of the Ellen Hermanson Foundation, has done an extraordinary job with her and her board. And I'm happy to be involved as chairwoman of the gala, which will have passed by the time this show airs, but it's going to be a great success. Now, Mirella, I would like you to talk a little bit about some of the projects that the hospital is raising money for now as we speak.
So the East Hampton Emergency Department is a vital part of providing access to healthcare on the East End. We all know with summer traffic that you cannot get from East Hampton to Southampton in a timely manner. You know, when there's a true emergency, traumatic injury, accident, heart attack, stroke, you need to be seen between 60 to 90 minutes for all traumatic events. And you cannot get from Southampton from East Hampton to Southampton within that time frame. That will directly impact the outcome, whether that's saving a life or whether it's the kind of impact of that event will have on that person's health and the quality of their life going forward. So it is critical that people in the furthest reaches of the East End, so Montauk, East Hampton, Amagansett, can get to a fully fledged emergency department within that 60 to 90 minutes time period, which is so critical for care. And with our emergency department in East Hampton, which will be a full emergency department with a full resuscitation unit, a cardiac unit, a cardiac room, fast track rooms, 10 exam rooms, full lab, imaging, telemedicine, and fully board certified emergency medicine physicians, an on-site ambulance 24 hours a day if transport is necessary. That is the way for us to deliver care to the furthest reaches of the East End. And I think the community has been incredible in their response. They have basically come forward and raised 31 of the originally 35 million.
Correct? 31 million of the 35 million needed.
And we've now increased the target to 38 million because we believe there is the desire to also put an MRI machine in there as well, which will complete the imaging suite. So we are nearly there to our goal. We absolutely believe that this is critical to care in East Hampton, and like I said, everybody who is in East Hampton, everyone understands the need for this and has been remarkable in their response. So we have got between $4 and $6 million still to raise, but we are confident we can do it, and we can complete construction probably between 18 months and 2 years. It's right in the heart of East Hampton, and it's critical to that community. So if anybody can help, introduce us to people who can help, want to know more about it, please contact me, because we really need to get over the finishing line, and we believe we can do it. So, but we do need that bit of extra last bit of help on that. So,
and Mirella, what is the website to donate?
Well, you can go to our website, and it's southampton.stonybrookmedicine.edu is the website. You look under the foundation, and there is a donate button. I'm also happy for anybody to contact me. So I can show them videos, I can show them plans, I can tell them all about the facility, to really show what we're doing, and hopefully engage, like I said, a bit more help just to raise that last amount of money that we need.
And how do people reach out to you, Mirella?
They can literally just call me at my office, 631-599-2062 is actually my cell phone, and I would love to hear from anybody who can help us complete our funding for the East Hampton Emergency Department.
And it is such an important center, the East Hampton Emergency Center, and I'm so thrilled to know that the hospital has raised $31 million of the 38 million needed. And we just have a few minutes left, Mirella and Laura. what do you want to leave the audience with?
I would say, get vaccinated.
Yeah, took the
You
words
know,
right out of my mouth.
Stay on top of your healthcare,
Yeah.
and if you can, support your local hospital. None of us, as you say, Jean, nobody wants to live in a place where we don't have access to first class care.
Yeah.
And we can provide it. And we appreciate every single person, every single gift, every single act of support. So if you can support in any way, we have so many different ways of becoming involved, volunteering and events and all kinds of things. Please support us, because we're here to serve you.
Yes, and I truly believe if you're going to support anything in the Hamptons, probably the number one group to support is Stony Brook Southampton Hospital, because we reach out to everyone. This hospital serves everyone in the community. No one is left behind. And most people don't want to live in a community with a hospital that they're not comfortable with.
Exactly.
The Stony Brook Southampton Hospital is a wonderful community hospital, serves everybody. And what better institution to support? And especially with this COVID pandemic, we've seen how important superior health care is. And on that note, I'm going to leave this to both of you. I know you want everyone vaccinated. What other bits of advice do you give? We have about 30 seconds left.
I just think it's very important that you continue to take care of yourself, regardless of the vaccine or screenings or what have you. You need to take care of yourself, and trust in us that we see you not only as a patient, but as a community, and that's what we're here for. So we want to be able to help you. And I think, what Mirella had said and you helping us, I think it's a very cyclical and very synergistic relationship. I've never seen a community like this before. It's just amazing to work here and the people. And I think that we're going to see great things in the future.
And we have a few great board members, Jean. So we're grateful to you as well for all you do every day.
And for getting the word out. Absolutely.
Yes, thank you.
For what you do.
Well, thank you very much. And thank you, Laura, and thank you, Mirella. This concludes Successful Philanthropy. Our guest today, Mirella Cameron Riley. She's the Director of Development at Stony Brook Southampton Hospital, and Laura Borghardt, who is the Administrative Development Officer of the Phillips Family Center. I'm Jean Shafiroff, your host. I'll see you next week.
Thank you.
Thank you.